I'm joined by the director of the Jayadeva Institute for Cardiovascular Sciences and Research here in Bengaluru, and I'm with Dr. K.S. Ravindranath, who have been entrusted with conducting an inquiry into the recent cardiac deaths that have been reported in the district of Hassan and several other district hospitals like Kalaburagi and Tumkur, as we get to know now. So there are a total of 26 deaths that have been reported as on today over the past 41 days from Hassan district alone. So, Doctor, what do you think the reason for these cardiac deaths would be?
One, I have learnt in the media that there are last 1.5 month there are more deaths, sudden deaths that are taken place in Hassan district and also recently of neighboring districts. So now the committee has been formed by the government of Karnataka under my chairmanship and other members, and also to coordinate with us the medical college, Hassan Medical Science and Medical Department and DHO. So they are trying to find out what is the likely cause for this sudden deaths that have taken place. The age varying from 20 to 60 like that. So when I was yesterday I had a VC, that virtual meeting with DHOs and Medical College Hassan, the doctors, and they say that some deaths have taken place. So there is no post-mortem done in any one of these things. So it is without going through their real medical history. It is difficult to say all of them are due to heart attack or something else. So now we have been entrusted the work to find out the likely cause. So we have made a pro forma to check whether these people to go to their places and take the history, whether those people have died at home or they had what symptoms they had. Did they suffer earlier similar symptoms? Are there any earlier medical history of taking medicines? Or they had any risk factors for heart attack, like were they smokers, or their substance abuse, or any tobacco chewers, or if they had any hypertension, diabetes, obese people, or there is any mental stress going through them, either job stress or various other things. So we are looking at or any genetic history, any family members in the family had a premature coronary artery disease, heart disease, so that we can indirectly arrive whether this deaths due to related to cardiac illness or otherwise.
So, but the deaths, the cardiac arrests are coming in people who are aged from 20 onwards to 50. The majority of them belong to this bracket of age. And is there any link towards the COVID vaccination as such, which is doing rounds now?
This cardiac deaths in younger individuals, even if it is 25, 30, unless proved otherwise, it has to be due to heart attack or coronary artery disease. There are certain other causes, rare causes, like where heart muscle can hypertrophy, that is called hypertrophic cardiomyopathy. Sometimes they have some structural heart disease, like arrhythmogenic right ventricular dysplasia, dilated heart, hypertrophied heart, sometimes electrical abnormalities like long QT, Brugada. There are certain other causes. But vaccines as such, so far even ICMR study in India done and elsewhere, vaccine is not responsible for heart attack. That's what the medical literature says. We are also looking into that. But the major studies which are done in ICMR and worldwide, vaccine is not really related to heart attack.
So do you think that the lifestyle and the food habits and other things post-COVID times would have been contributed to this? Like anything more to say for them?
Yeah. We have also studied some 250 patients who came, young patients less than 40 years who came and treated in Jayadeva Institute of Cardiovascular Sciences for heart attack. We compared this group and before COVID 2019, so also we had some data of premature coronary artery disease in young. We compared, so there is an increase in the risk factors. There is a change in the lifestyle and the food habits and stress, probably the stress they went, some of them lost jobs, they were at home, some increase in the incidence of hypertension, diabetes and cholesterol levels, and also increase in the incidence of smoking. Maybe 7 to 8% is more compared to the pre-COVID era. Those those risk factors which have changed pre-COVID and post-COVID are more likely responsible for this heart attack rather than the COVID vaccine per se.
Okay. So now, like you earlier said, the 26 deaths have occurred over the period of 41 days, and like you earlier pointed out, the post-mortem reports could prove, would have given you much more data as to what was the cause. And now you're saying that you have to depend only on the family history or the medical history of such patients. So how successful this report is going to be, and you have to do it in 10 days is what the government says. So your take on that?
Yeah, now we have doctors in the physicians in Hassan Medical College because to go through the details of this deaths that have occurred based on their medical history, which we have given a pro forma to go into the details of all the risk factors and the circumstances under which the patient died. I think it will it's some type of, if you want to call, verbal autopsy, not a true autopsy. It may throw some indirect evidence. It may not truly pinpoint that the death is due to a heart attack or coronary artery obstruction. So we may have some based on the evidence of the medical history and the family history and the risk factors. It is more of an indirect proof. It likely to be cardiac rather than a direct evidence.
Thank you so much for sharing that with us. So that was a director of the Jayadeva Institute of Cardiovascular Sciences and Research Hospital in Bengaluru on the unusual cardiac arrest deaths, which is around 26 in the Hassan district alone. With camera person Pawan Kumar, this is Belly Thomas for NewsX, Bengaluru.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.